Mobility CE course. Lesson 1. Supporting mobility. Mobility is an essential part of a person's independence. Many factors can contribute to limited mobility, including physical injury, medication, or can be hearing or eyesight. All these things can cause physical and mental and emotional effects. When someone has a physical, mental, and emotional effect, that can have effect on their daily living, like they can have constipation, urinary problem, depression, anxiety, and more. So caregivers who are working with clients with limited mobility, they need to help clients. Helping a client move is physically demanding and can cause serious injury. The proper body mechanics and techniques will help you protect your back, neck, shoulder, knees, and wrists. So before helping a client move, make sure you can perform the move safely and without strain or injury. Plan to use any assistive device that are available. If possible, get another person to help when necessary. Before you support any weight, make sure that your body is steady in a strong position. Spread your feet about shoulder width apart and put on one foot slightly in front of the other. This position will keep you steady and protect your spine. So we always need to prevent our back from injury. So we do this by bending the waist or twisting your body while supporting weight. It's very dangerous and can cause back or spinal injury. So whenever you try to pick an object or you help a client carry, you have to hold the weight as close to your body and keep your back, feet, and trunk aligned, and do not twist at the waist. This is very important. You need to use your legs. The muscles on your legs and buttocks are stronger than the muscles on your lower back. Bending at the waist and lifting with your back can cause fatigue and injury. So you need to avoid lifting. As much as possible, consider pulling, pushing, or sliding heavy objects instead of lifting them. Caregivers are at high risk for back and shoulder injuries. So as any skill that you do, transferring a client, helping a client to transfer, there are skills. You need to have skills. The first thing is you have to make sure clients are comfortable, and you need to keep their dignity, privacy. You need to listen and speak clearly and respectfully and explain what you're doing and things like that. And you have to use any assistive device correctly and safely. Be aware of any and address any safety concerns related to the task. There is a skill here in your book, assisting a client to walk. You can assist a client to walk with or without a gait belt. But generally there are tips how to help client to walk. You need to communicate and look around the area that you are in. Is the person ready? Is the person rushed? Do they have their eyeglasses? Do they have their hearing aids? What kind of level of assistance they need? And check the path before starting to walk. And make sure it's clear and free of clutter. And all the time, whenever you help a person to transfer, keep the client's body straight, just like yours. If a client has a weak leg, you always need to help the client by pressing your knee against the client. Once the client is standing up, it's good to suggest that the client to stand straight, look forward, and keep a measured, smooth rhythm. Okay, your book shows how to help or assist client to walk the stairs up and down. It's generally up is good, down is bad. So when you go up, you have to use your good leg first. Down is bad. Your bad knee, your bad leg goes first when you go down. So remember those two. They help you to remember which leg goes first. There are different kind of assistive devices that we can use, like walkers, canes, crutches, and braces, and more. But your book talks about those, and it's good to know them and familiarize yourself with them. And there's another skill here, transferring a client from a bed to a chair or a wheelchair. Transfer. Transfer is changing a client position or moving them from one surface to another. Transfer are very personal. A client knows what works and doesn't work and will have a definite opinion about how they wish to transfer. In order to prevent injury to the client as well as to yourself, it's important to follow best practices with every transfer. There are a gate belt or transfer belt. Yeah, you are using that to transfer. There are different things that you use. We use a draw sheet. We also use a mechanical lift, like a seat to stand, Hoyer lift, and other enablers, like side rails or bed canes, like that. I'm sure everybody knows how to use a gate belt. Falls are major health problems for older adults. Experiencing a fall can have serious negative effects on client health and quality of life. Home care aids can help minimize the risk of falls by removing fall hazards and encouraging clients to make healthy and safety choices. Home care aids must know how to respond to fall and understand the policies in the care setting. Fall must be well documented and reported to help prevent future falls. Okay, what are the causes of fall? Falls can happen because of environmental or health-related causes. Environmental causes are like low or poor lighting, furniture, pets, or uneven floors. Health-related causes like infection, vision, hearing, medication, and diseases that in risk for fall are like stroke, delirium, depression, Parkinson's. So, what are the consequences of fall? The first one is injury. Of course, people get injured when they fall. More than 95% of hip fractures are caused by fall, or other injuries often include fractures to the wrist, shoulder, or spine. Falls can also cause internal bleeding and traumatic brain injury, and also cause the consequence of fall is fear and loss. Many clients fear falling, especially if they have fallen before, or they lose confidence in their ability to move around safely. This fear can limit their daily activities and can limit their socialization. They can be depressed, and it can lead to loss of mobility. How do we decrease fall? How do we decrease the fall risk? There are many things you can do to reduce the risk of falling for a client. One is footwear, shoes. All clients should have sturdy walking shoes that support their feet and ankles. What to do if you see a client falling? What do we do about it? First, try to support the client head and gradually ease the client onto the floor. Then keep your back straight, position your feet for a wide base of support. And flex at the knees and hips as you lower the client to the floor. If you are behind the client, gently let them slide down your body. Do not try to lift or catch a client who is falling. Lower them as slowly as you can and try to get them to land in a way to minimize injury. What to do if a client has fallen on the floor? This client is already fallen on the floor. What do we do? Usually follow your agency policy, but immediately you have to ask immediately what happened, how you feel, and if the client says I'm not hurt or they're comfortable and they just get up. Sometimes the clients get up but they are not okay. They're just ashamed they fall. So it's good to observe the client closely, and if you see something that injured the client, you have to call 911 and stay with the client until the EMT arrived and document, of course. What to do after a fall? After a fall, monitor the client for injuries or changes in condition and respond to them promptly. Look at the client's body to see if there are any injuries, bruises, cuts, abrasions. Check for skin temperature. Listen for changes in breathing. Do the vital signs. Of course, you have to report to your supervisor or provider. The fall will also probably be reported to the client's doctor or family member, and you have to document. Thank you very much.